Hello, I'm Dr. Matt Miller. I'm a board certified cardiologist with Thrive North Scottsdale. It's a private practice, multi-specialty practice, and emergency practice. By way of my background, I was trained at the Ohio State University, both undergrad and veterinary school, completed a residency there, and then served on the faculty at Texas A&M University for 26 years prior to moving out to Arizona to move into private practice. So there's a couple things I want to cover today. Primarily what we're going to be talking about is valvular heart disease. We're going to talk about classification of valvular heart disease. We're also going to talk about management of valvular heart disease. You're probably familiar with some of the classification schemes for other diseases such as dental disease and renal disease, but you may not be as familiar with classification of valvular heart disease. And in the title, I have classification and management of valvular heart disease, why it matters. One of the reasons that it matters, and probably a very important one, is it allows us to speak with our clients intelligently to establish both a diagnostic and therapeutic plan. There's some very important prognostic information that we know based on the classification that the patient sits in. And so what we'll do is start off with a background of valvular heart disease. Then we'll talk about some of the diagnostic tests that we utilize to classify the disease. And then we'll move into therapy, and we'll go from nutritional, supplementational, and then, of course, sort of standard accepted cardioactive drugs. And I'll use cardioactive versus cardiosupportive statements primarily because the products that we'll talk about or the drugs that we'll talk about can fit into either category. And we'll talk a little bit about why that becomes important. So why are we interested in valvular heart disease? We're interested in valvular heart disease because it makes up about 70% of all the disease that we see in the dog. Now, we see a smattering of congenital heart disease, many of which we have interventions for, pericardial disease, both neoplastic and non-neoplastic, dilated cardiomyopathy, both heritable and nutritionally associated, and depending on where you practice, heartworm disease. But you can see from this pie chart that valvular heart disease is very important, and therefore we're going to concentrate on that. And really the classification scheme that we'll describe is really set up best for valvular heart disease. Now we have to think about how we're going to make the diagnosis. So those of you that are in preferentially small animal practice most likely see a dog with valvular disease every single week, if not every single day. It is a very, very common disease process. Most of the time we're looking at small breeds. Okay, so if we look at signalment, it's usually small breed dogs, meaning less than typically 10 kilograms, although large breed dogs will get valvular heart disease. There are some very specific breed predispositions that are well established. In the slide, you can see a line of Cavaliers. Cavalier King Charles Spaniels are the classic breed afflicted by valvular heart disease. We see a lot in Havanese, Shih Tzus, Lhasas, Dachshunds are another classic breed. When you think about larger breed dogs, then I start to think about some of the Sighthounds, Labradors, and to a lesser extent, Doberman Pinschers, although they are classically afflicted by dilated cardiomyopathy. We're going to talk a little bit about the history, primarily because there are other diseases that have similar histories that we need to at least have in the back of our mind and not jump to a conclusion that because this patient has valvular heart disease and his clinical signs are associated with his valvular heart disease. And the reason for that is there is a large number of dogs with valvular heart disease that do not become clinically affected, do not go into heart failure, never show symptoms, and some of them never need specific cardioactive therapy. We'll talk about physical examination, probably the first thing that tells us, hey, this patient probably has cardiac disease. We'll talk about thoracic radiography. This will not be an extensive course on thoracic radiographic evaluation, but it's important because one of the parameters that we utilize to categorize these dogs is thoracic radiography. We'll briefly mention electrocardiography, although it plays a minor role. And then we'll talk about echocardiography. And echocardiography is important because some of the most specific indicators of the classification are based on echocardiographic parameters. You can classify these dogs without it, but it's much more specific when we use echocardiographic evaluation. So physical examination plays an important role. Remember, we are talking about valvular heart disease. When you talk about valvular heart disease, those dogs are going to have a murmur. And some clinicians, especially those who are just starting out in their careers, say, well, maybe I just can't hear the murmur. Remember that dogs with important valvular heart disease, so degeneration typically of the mitral and tricuspid valve, those dogs have a very obvious murmur. So if you look at a trial called the EPIC trial showed that the drug vetmedin or pimobendan could slow the progression of preclinical to clinical disease. All of those dogs to get into that clinical trial had to have at least a 3 out of 6 murmur. So those murmurs are pretty loud. Those are ones that an experienced clinician basically will never miss. When we look at some general things that I think are sometimes misconceptions, I think a misconception is if dogs are really heavy, they probably don't have heart disease. If they're symptomatic, they probably have lung disease or airway disease. That's a very, very broad categorization. The respiratory sounds, I continue to be amazed at how bad I am at differentiating specific diseases simply based on thoracic auscultation of respiratory sounds. So if respiratory sounds are abnormal, basically what that's telling you, and especially if the patient has a cough, that is an indication for thoracic radiography. Heart rate and rhythm. Cardiac rate and cardiac rhythm can give you insights into the importance of any underlying disease. Now, we will differentiate between heart disease and heart failure. So heart disease is any abnormality of the cardiac system. So if you have a leak in your valve, you have heart disease. If you have an arrhythmia, you have heart disease. If you have elevated pressure, you may have heart disease. That doesn't mean you have heart failure. And in veterinary medicine, usually when somebody says heart failure, it is implied that it is congestive heart failure. Congestive heart failure because most of our patients don't give us enough insight into say, well, maybe you have reduced cardiac output. So when we say heart failure, let's assume for this presentation, we're talking about congestive heart failure, which means fluid accumulation. If your left side is failing, fluid accumulates in your lungs. If your right side is failing and you're a dog, fluid almost always accumulates in your abdomen. And you'll see at the bottom of the screen, the last thing I have is murmur. And sometimes people will say, well, why don't you have murmur at the top of this slide? Seems logical. I put it at the bottom of the slide because all of these dogs have a murmur. If you have a small breed dog that does not have a murmur, the likelihood, and we're talking about an aged dog, okay? So a dog 8, 10, 12 years old, small breed dog. If he doesn't have a murmur, the likelihood that he has clinically significant heart disease is exceptionally low. The exception to that would potentially be a dog with pericardial disease. But if you remember that pie chart, that's a couple percentages of all the disease that we see. Okay. So these dogs typically have a murmur. If they have heart failure, they'll have abnormalities of auscultation, etc. Now, when we're trying to evaluate these dogs, how are we going to decide if they have important disease or not? And one of the biggest things that we can do is take a chest x-ray. A chest x-ray is going to give us insight into whether or not the heart is enlarged. Why is that important? Because of the disease that we're discussing, valvular heart disease, degenerative valvular heart disease, also referred to as degenerative mitral valve disease or endocardiosis, because it's a degenerative, not infectious process, that is a volume load on the heart. And if the volume is large, the heart will remodel, change its shape, size, etc., based on how important the volume leak is. So if we look at a chest x-ray and the heart is not enlarged, that tells us that if this dog has a leak, you probably suspected it because of their murmur, that it's probably inconsequential and probably doesn't need intervention. And we'll talk about classification of these guys in more detail as well. And on this slide, I've listed shown radiographs from two normal dogs to reemphasize the fact that morphology makes a difference in what they look like. And then I've given you some specifics that we're not going to go into in detail, but here's some specifics that will allow you to quantify the overall size of the heart. We'll get in that in a little bit more specifics as well. And very briefly, people ask about should we take a VD or a DV? Doesn't matter. Be consistent. This is a VD and a DV from the same dog on the same day, and you can see how different they look. The importance there is get used to looking at one view and have your technical staff provide that view for you every time. You'll be a much better radiologist then. So assessment of cardiac size, it's nice to have something objective. And that objectivity is a thing called vertebral heart scale. Most of you are familiar with this. Many of your digital radiographic programs have this built in. There's now an AI version of this that can give you a VHS actually quite accurately. And simply, it's a measurement from the carina to the apex. And then perpendicular to that measurement, we measure just below the caudal vena cava to the front aspect of the cardiac silhouette. And then we compare that to starting at the fourth thoracic vertebrae. How many vertebrae does that cover? So vertebral heart scale. Normal is less than 10.5. Some people will go up to 11. In some breeds, I think that's appropriate. In some breeds, I don't think it's appropriate. And in this dog, you can see his long axis measurement was 5.25. His short axis measurement was 4.5, with it gives him a 9.75, which is well within the normal range. This dog, on the other hand, has very important valvular heart disease. The trachea is elevated, the left atrium looks big, and when we do a vertebral heart scale, you can see his works out to be 13.75. What does that tell me? That tells me this dog has tremendous overall cardiac enlargement, and because we can appreciate that the majority of the enlargement is top to bottom rather than side to side, it tells me that the left atrium is enlarged. Left ventricle is enlarged. And you can see that the left atrium is enlarged in this patient as well. Now, since this is a disease of the mitral valve, we expect the signs of cardiac enlargement to emphasize the left side. So here you can see arrows outlining the left atrium. Remember that the left atrium sits at the back and on top of the cardiac silhouette. And as we bring an animation in here, I think we can appreciate where the left atrium sits. Okay? Here we can see the left atrium here. You can see the arrows pointing to the outer portion of it. Now you can also look at a version of left atrial enlargement. That's called the VLAS, okay, the vertebral left atrial size. And here we can appreciate, we're looking at the beginning of the fourth thoracic vertebrae, and we're making a measurement from the carina to where the caudal aspect of the left atrium hits the caudal vena cava. And anything over 2.5 usually means that patients will fit into the category of B2. Now, we haven't talked about the categories, but remember that because we're going to go back to that when we talk about classification and how classification helps us drive decision making. If the left ventricle is going to get big, it usually occurs in an elongation of the cardiac silhouette. So this is a Sheltie with valvular disease, really tall heart. Here's a big left atrium back here too. So he's got left ventricular enlargement and left atrial enlargement. Pretty characteristic of dogs with valvular heart disease. So if we summarize what we might see with thoracic radiographs, what I expect to see is initially left atrial enlargement, left ventricular enlargement comes next, then the trachea gets pushed up as the left ventricle gets big. You may or may not see left main stem bronchial deviation, and sometimes that results in chronic cough. And then ultimately the pulmonary veins distend and you develop pulmonary edema, and now this is congestive heart failure. So this is a series of dogs, of radiographs from the same dog that was in a study that we ran while we were at Texas A&M University. And this was before the EPIC trial, before Pimo had been known to be efficacious. And what we can see here is this is a normal cardiac silhouette. The VHS is well within the normal range. The vessels look fine. The caudal vena cava is normal. The aorta looks normal. So this is a normal dog. This dog has a murmur, and by echocardiographic evaluation, we knew this dog had mitral regurgitation, but his radiograph is normal. So what does that tell us? What that's telling us is that the volumetric leak, and I know he has a leak based on his murmur, and of course we echoed this dog as well, based on the fact that his cardiac silhouette is normal on his radiographs, tells me that his leak is inconsequential. And again, that's going to be really good information because it's going to tell me what category this dog sits into. And now we're going to be able to figure out what we should do with them. And we can also talk to our clients about prognosis. Same dog about 2 years later. What do we see here? Well, now we see this very large left atrium. We also see that the length of the heart has increased. So now he has left ventricular enlargement as well. And you can see that his trachea is now elevated, basically parallel to his spine. And what that tells me is that this dog has remodeling. His cardiac silhouette is enlarged. What does that tell me? That tells me that the leak is big. And now he's going to change categories. And again, we're going to review this. But now we know that his disease has progressed. And most likely this dog will develop heart failure in the future. And this is his film approximately 6 months later. And now we can appreciate that he's got substantial left atrial enlargement. Now, if we look at his lung parenchyma, it's abnormal. He's starting to develop congestive heart failure. So in those radiographs, the importance of that series of radiographs is that dog went from a dog with having a murmur, so heart disease with no remodeling, normal cardiac silhouette on radiographs, to a dog with heart disease, no evidence of heart failure, but cardiac remodeling. Left atrium was big, left ventricle was big, and then went on to develop congestive heart failure that we could tell radiographically. And we'll go through what we would do with those dogs from a classification standpoint and then to a therapy standpoint. And here is now a dog with congestive heart failure. This is pretty characteristic appearance of a dog with valvular heart disease and resultant congestive heart failure. This dog has an elongated cardiac silhouette. He also has a wide cardiac silhouette, so lots of cardiac remodeling. And if you look both in the lateral view and in the ventral dorsal view, he has parenchymal infiltrates that are consistent with left-sided congestive heart failure. Now, not every dog that has a murmur and has clinical signs has heart failure, right? There are a lot of dogs, and we're going to reemphasize this multiple times, a lot of dogs that have a murmur that don't have cardiac enlargement, aren't in heart failure, and they're symptomatic for some other reason. And remember, in this subset of dogs, or this signalment, the things we typically think about are inflammatory airway disease and dynamic large airway collapse, tracheal bronchial collapse, probably associated with bronchomalacia. And that was the situation in this dog, is that this dog had a loud murmur. That's why it was presented to us for evaluation. But if you look at overall heart size, isn't very big. He's got a lot of bronchial changes. And this dog underwent a CT scan and bronchoscopy. And the dog had quite severe inflammatory airway disease and bronchomalacia. So just because a dog has a murmur and symptoms doesn't mean they're in heart failure. I would conservatively say I spend 20% of my clinical day decreasing cardiac medications and oftentimes stopping cardiac medications rather than initiating more. And here is just an example of a dog with tremendous left atrial enlargement. And if you look, his left main stem bronchus is being compressed, which probably contributes to persistent cough in some of these dogs who have important disease. You get them out of heart failure, but they continue to cough. And it's something to think about. It can be very frustrating. Okay. ECG. ECG doesn't play an important role in dogs with valve disease. A lot of times, just as we see here, you'll see dogs that are in heart failure come in with sinus tachycardia, but they usually don't have important rhythm abnormalities to begin with. That being said, once you get good at managing dogs with valvular heart disease and you have them survive 12, 18, 20 plus months after going into heart failure, then sometimes they will develop important arrhythmias. This is the one we see most frequently as a reason for decompensation. This is a dog with atrial fibrillation. You can see the very rapid, roughly 200 beats per minute, very irregular R-to-R intervals. And of course, we don't see any P waves, sort of characteristic electrocardiographic findings for atrial fibrillation. It's one of the reasons that the dogs that were previously well controlled and managed go back into heart failure. Something you need to pay attention to, especially in those patients that you're successfully monitoring for months and sometimes even years. How about echo? Echo is the gold standard for diagnosing valvular heart disease and assessing its severity. So we're looking at remodeling, so enlargement of the left atrium, enlargement of the left ventricle. These dogs have very characteristic echocardiographic findings with nodularity of the AV valves. Their myocardial function is commonly normal. In fact, many times in dogs with important volumetric MR, early on their systolic function is hyperdynamic. We'll talk a little bit about that. Okay. So this is an echocardiographic image. This is the left atrium. This is the pulmonary artery. This dog also had heartworms. That's what we're seeing here. But you can see this very abnormal mitral valve, especially the anterior leaflet, which is right here. It's markedly thickened. And you can see it's no longer perfectly coapting with the posterior leaflet. And in fact, it's prolapsing back into the left atrium. That's pretty characteristic of dogs with large volumetric mitral regurgitation. And it's a very characteristic finding. Sometimes you can have failure of the support apparatus, which are the chordae and portions of the mitral apparatus, that lead to acute decompensation. So when we look at the size of the heart, some people will use M-mode measurements of the left ventricle and the left atrium. Others use two-dimensional. Both are accepted. One of the things I wanted to point out here is that in these dogs, most of the time their systolic function is pretty good. Remember that most of these dogs don't develop systolic dysfunction until later in their disease. Once again, when you get better at managing these dogs and have them survive past their initial bout of congestive heart failure and maybe multiple bouts of congestive heart failure, you may see as their disease progresses that their myocardium begins to fail, as we start to see here. You can see this is the septum contracting and the posterior wall contracting. You see there's a difference because the posterior wall is basically starting to burn out. Some of these dogs will develop pulmonary hypertension and pericardial effusion as well. Pericardial effusion in these dogs is also sometimes associated with left atrial rupture. One of the reasons for decompensation in these dogs is chordal rupture. So here is the posterior leaflet. Here's the anterior leaflet. You can see it flipping back all the way into the left atrium. You can see the cord hanging off the edge of the valve right there. And this is a postmortem exam in this same dog. You can see a very thickened anterior mitral leaflet. This is an open, huge left atrium, and you can see a primary cord hanging right off his the edge of his valve leaflet. He also has a partial thickness tear in his left atrial endocardium, probably associated with in a very abrupt increase in volumetric mitral regurgitation, and then subsequently stretching of the endocardium of the left atrial wall, which is already diseased, and then a tear. Not a full thickness tear, at least in this one, but so here again is a dog with really severe changes in his mitral valve. Here's his left atrium. You can see how irregular this mitral valve appears, and that's associated with degeneration. Remember, this is not an infectious disease. Now, some people will mistakenly say, well, this is probably a change secondary to chronic inflammation, and they always point to dental disease. Although I completely agree that really good dental health is important for multiple reasons, it is not necessarily associated with degenerative valve disease. This degenerative valve disease is a heritable condition. We see it in dogs with with minimal dental disease. That being said, continued inflammation associated with unchecked dental disease is going to lead to degenerative changes and especially vascular changes. So it's going to be important to maintain good dental health in these patients. Unfortunately, some of these patients develop a murmur, then people are reluctant to put them under general anesthesia, and then their dental disease gets out of control. One thing to remember is that most of these dogs do actually quite well under general anesthesia, especially most dogs that have not yet gone into heart failure. They usually do quite well under anesthesia. So don't preclude dental procedures in these dogs just because they have a murmur, especially if they've never been in heart failure. Again, here's the left atrium. Here's a markedly thickened anterior mitral leaflet, really pretty characteristic of dogs with valvular heart disease. So we've talked about the disease itself. What does it really represent? We've talked about physical examination. Most dogs, if they're going to be symptomatic, they're going to come in for cough or shortness of breath. Okay, so we've talked about history. We talked about thoracic radiographs. Thoracic radiographs play a really important role in getting an idea, one, whether or not the heart is enlarged. And we talked about the fact that without cardiac enlargement, you probably don't have important valvular heart disease. You can have heart disease, but most dogs with important volumetric mitral regurgitation have very notable radiographic enlargement. We talked about echocardiography. We talked briefly about electrocardiography. Okay? The question comes up, are there other diagnostic tests that we can do in these patients to try and get an idea of how severe or how important their disease is? You're probably familiar with NT-proBNP. A lot of times it's just referred to as proBNP or BNP anymore. It's a peptide hormone secreted by the left ventricle, typically in response to wall stretch. And as we stated, this is a big volume load on the left ventricle. It really dramatically increases during heart failure. And again, when we talk about heart failure in this presentation, it's congestive heart failure. NT-proBNP concentrations have been shown to discriminate between respiratory distress of cardiac versus non-cardiac origin. It's been used to diagnose preclinical heart disease. There are more and more data in the literature that suggests that the higher the BNP, the more important the volumetric disease is. And then there are groups that are looking at trends in BNP as an indicator of cardiac therapy, efficacy of cardiac therapy. So absolute cutoffs for that are ongoing investigations, but that's something that you can potentially look forward to in the future. Okay? There is a canine specific test available, both an in-house with a machine called a BioNote, and then of course the original test was developed by IDEX, and you can get that done through the primary laboratory. So, what does BNP do? How does it help us? How do we interpret if we run a BNP? How do we utilize that to maybe help us categorize these dogs, maybe decide whether or not we go to additional diagnostics? All right, if there is money limitations, maybe not everybody can afford follow-up thoracic radiographs or echocardiographic evaluation. Well, remember, anything up to 900 is probably normal. That dog's probably got a normal heart. Or if that dog has a murmur and his BNP is less than 900, he probably has inconsequential mitral regurgitation. One thing to remember is BNP can vary by 25 to 30% day to day, right? So it's not if it's 800 today and it's 900 tomorrow, that's not a difference. That's well within the normal day-to-day variation. If we go over 900, now we start looking at what are logical cutoffs for us. The number that's come up in multiple clinical trials is 1800. And what does that mean? If you have a dog that's between 900 and 1800, that dog probably has significant heart disease, meaning that dog probably has cardiac remodeling. That dog might fit into a different category, might require some intervention. But he's probably not in heart failure. Most dogs that are in heart failure will be over 1800. If you have a dog that has clinical signs and his number is above 1800, you can feel pretty comfortable that his clinical signs are associated with heart failure. And additional diagnostics probably need to be done, including thoracic radiographs, ideally an echocardiogram as well. Okay. So remember these radiographs that I showed you before. When I showed you these radiographs, this dog in that study was also monitored with BNP the whole time. Okay, so let's look at his radiographs. Start at the low left side. Okay, that's when he started in the trial, and his BNP was 328, well within the normal range. Okay? As he progressed, now we went up to 1512. Remember what that 900 to 1800 range means. It means important cardiac disease, but no evidence of failure. And then as he goes into heart failure, that we can see at the top right-hand portion of the screen, his number is 3211. So his numbers fit very well, and it doesn't always fit that nicely, but you can see that BNP can give you a lot of information that oftentimes correlates very nicely with radiographic evaluation, and it might be an additional diagnostic test you want to consider if you're not certain about your radiographic findings. Okay, so hopefully each one of you has a pretty good idea of what diagnostic tests that we can utilize to diagnose valvular heart disease, maybe categorize it as well. And I know I've been sort of teasing with the categorizing or classification scheme. We're going to get to it very shortly, okay? Hopefully you understand what diagnostic tests are available to us to help put together a clinical picture and decide how do we manage this patient? What do we talk to the client about? Okay. So when we talk about heart failure, right? So we've moved from heart disease to heart failure. Okay. And it's a big difference. And some people say, it's not that big of a difference. It's a huge difference. Okay. Huge difference between heart failure and heart disease. Heart disease may or may not need any intervention. Heart failure definitely needs intervention. And the change from heart disease to heart failure is a big step, meaning it has prognostic implications, right? And the questions that come up about management of heart failure commonly are, when do I start therapy? Okay, can I do it based simply on physical examination? Do I need other diagnostic tests? Can I simply say this dog has a murmur, therefore I'm going to start therapy? The obvious answer is no. Radiographs are really helpful. Radiographs can be utilized almost exclusively if you want to for management, assessment, classification, management of dogs with heart disease. There are, of course, limitations. Electrocardiography, really important for dogs with arrhythmias, but we already stated that dogs with valve disease usually don't have important arrhythmias when we start off. And then echocardiographic evaluation, gold standard. If the owner can afford it, definitely help us because it can tell us importance, severity, complications, and give us some prognostic information as well. Okay, so if the dog has pulmonary hypertension or a ruptured cord or systolic dysfunction, those are all things that are going to change the prognosis and help us guide our clients as far as decision making and also managing their expectations. What's going to happen to my dog? Because they always ask you that, right? What's going to happen to my dog? The other question that comes up is, what drugs do I utilize? What's the role of supplements? What's the role of nutrition in management of dogs with valvular disease? And so what we'll talk about is some of the drugs that we use routinely. We'll talk about the role of nutrition and supplementation as well. Okay? So here it is, the classification scheme, right? We talked about the classification scheme. It was in the title. Why is it important? Because if you understand this classification scheme and you can utilize the diagnostic tests we've reviewed to get these dogs appropriately classified, then you can give really, really accurate prognostic information, diagnostic recommendation, therapeutic recommendation to your clients. So let's go through this. So this classification scheme is referred to as the ACVIM classification scheme. It was really modified from a classification scheme put forth by the American College of Cardiology and American Heart Association over 20 years ago. Stage A. Stage A is no structural disease, but high risk for developing heart disease. What does that mean? That means you were born a Cavalier. Means you were born a Doberman Pinscher. If you're in cats, you were born a Mancoon. Okay? Stage B1, asymptomatic disease. Okay, so remember, stage A doesn't even have disease yet, just has a predisposition. Stage B1, asymptomatic disease, minimal remodeling. What does that mean? It means the dog has a murmur, has no clinical signs. You picked it up on routine wellness evaluation, and his radiographs are normal. His echocardiogram shows regurgitation but no remodeling. Okay. Stage B2. B2 dog is has asymptomatic disease with significant remodeling. Heart failure, now stage C, that's past or present signs of heart failure. And then stage D is end stage heart failure, signs that are refractory to therapy. We'll talk a little bit about those. Now, one of the things to point out is that if I can stage these guys, I can give owners quite a bit of information about what's going to happen. Okay, so stage A, your dog may never have clinical signs. Stage B1, and we're talking specifically about valvular heart disease right now. Okay, in stage B1, those dogs have less than a 1 in 3 chance of ever going into heart failure. So those dogs have a pretty good prognosis. Stage B2, and remember, B2 and B1 dogs, at least clinically, look really similar. Their diagnostic tests are different, but they're similar. Stage B2 dogs, those are dogs that have significant remodeling, have a 50% chance of being heart failure in less than 2 years. So really dramatic difference between B1 and B2, and their recommended therapy is different as well. We'll talk about that when we talk about therapy. Stage C dogs, once the dog goes into heart failure, what's going to happen? That dog probably on average is going to live 13 to 20 months, assuming that you don't do something dramatic, okay, like valvular repair or something like that. And then stage D dogs that are becoming refractory to standard therapy, those dogs are probably going to be living weeks. Patients with stage A disease are at-risk breeds. They do not have evidence of heart disease, or just at risk for it. Stage B dogs, on the other hand, have either B1, where they have a leak but minimal or no cardiac remodeling, or stage B2, where they have no clinical signs, so no cough, no shortness of breath, no exercise intolerance, but they have notable cardiac remodeling. And as we stated previously, differentiating those two dogs are very important, in my opinion, from two different aspects. One is prognosis. Remember, B1, less than 1 in 3 chance of ever going into heart failure. B2, 50% chance of being in heart failure in less than 2 years. B1, no cardioactive medications. B2, substantial evidence that cardioprotective, cardioactive agents can make a difference in prognosis. Stage C, as you can see from the radiograph here, this dog has cardiac enlargement, has a preferentially perihilar distribution of parenchymal infiltrate, and that is stage C. In stage C, there's specific recommendations for therapy in the consensus panel statement. And then stage D. Stage D is a dog that you've been managing for a while, who's now no longer responding to standard recommended therapies. So this dog may be receiving 4, 5, 6, 7 medications multiple times a day in an attempt to keep them symptom free or minimize the clinical impact of their disease. So how can we manage these? If you think about improving cardiac function, there's a couple things you can do. You can optimize filling by adjusting their rate or improving relaxation. You can decrease their afterload, so open their systemic vasculature to reduce the amount of regurgitation. You can address arrhythmias if they develop. Remember, dogs with valve disease usually don't develop them until later in their life. And then you can increase contractility. And once you're done with that, unless you do an intervention, then you just have to manipulate those parameters. So when we talk about an intervention, what are we talking about? Well, there's a range of them, but the most common ones right now are either definitive surgical repair, and the groups that there's a couple Japanese groups that are exceptionally talented at on bypass valvular repair. University of Florida has a program, although I believe there's a 1-year waiting list already. There is a procedure called a transcatheter edge-to-edge repair. You'll also see that abbreviated as TEER, where a catheter is placed through the apex of the ventricle and a clamps the valve leaflets together to try and reduce the amount of prolapse and amount of regurgitation. Colorado State is probably the most accomplished group. Texas A&M, University of Illinois, 2 private practices in Los Angeles are doing them as well. And then there's a procedure called a left atrial decompression procedure, where an atrial septal defect is created that gives the left atrium a pop-off valve to decrease those big spikes of left atrial pressure associated with mitral regurgitation. And again, there are several private practices, including our own, that perform that procedure. The majority of patients don't undergo an interventional procedure. The majority of them are managed medically. Right? So when we talk about therapeutic options, especially if we eliminate definitive repair, etc., you can do dietary manipulations, typically associated with sodium restriction. And I have a picture of 2 of the, in my opinion, the best products out there: the Early Cardiac Diet by Royal Canin, and then Purina Pro Plan Cardio Care, both of which are very high quality diets, with the understanding that they're not therapeutic, that they're moderately sodium restricted. Severe sodium restriction is oftentimes associated with inappetence, and these patients already pose a challenge from a nutritional standpoint. So we typically don't recommend severely sodium restricted diets. Supplementation. Supplementation plays a role in these patients, and very important, I would call it cardiosupportive therapy rather than cardioactive therapy. And why I make the differentiation is that in some supplements will have cardioactive components to that, either digitalis like supplements that may affect cardiac rhythm or cardiac contractility. And very importantly, many of the herbal diuretic products or natural diuretic products are included in some, especially combination supplements. And when I look at supplementation, I really look at it from a supportive standpoint. So, what I'm looking for is something that will provide my patient with the nutritional substrate for optimal cardiac health from a contractility standpoint, from a vascular responsiveness standpoint. But I do not want something that is going to either interfere with or potentially augment side effects of some of the cardioactive drugs. Okay, a classic one would be dandelion root. Dandelion root is seen in a lot of cardiac supplements, and it is a known diuretic. So we really don't want these patients to be on a diuretic, especially before they go into heart failure, in addition to the diuretics that they ultimately might be prescribed when they go into heart failure. We'll talk about vasodilators, we'll talk about diuretics, we'll talk about positive inotropes as well. When we talk about cardio supportive supplementation, what we're really looking at is we're looking at a supplement that will provide what we believe to be um, important support of normal cardiac function. One of the supplement in the slide is by Dr. Fossum's Pet Care, called the Cardio Chew. And if you look at its content, so carnitine and taurine, known amino acids necessary for optimal therapy, for optimal cardiac energetics, EPA and DHA, anti-inflammatory, pro supportive of vascular tone. There is at least one study that shows that um, fish oil supplementation may be associated with reduced frequency of ventricular arrhythmias. That was, of course, in boxer dogs. Um, N-acetylcysteine for optimal vascular tone, also anti-inflammatory and a free oxygen scavenger. Arginine, once again, really trying to double down on making sure we have the substrate for optimal vascular responsiveness. Um, Coenzyme Q10, additional green lip muscle oil, folic acid, magnesium, potassium sorbate, and alpha tocopherol as well. So you can see that there is a wide array of supplements there that will optimize cardiac energetics, very importantly, vascular tone. But there is nothing in this supplement that would lead to specific cardioactive behaviors. No alterations in rhythm, no alterations in volume status or contractility. Diuretics that we utilize, diuretics most commonly employed are loop diuretics, furosemide, less commonly torsemide. And then, of course, spironolactone is a potassium sparing diuretic that is used very commonly in dogs with congestive heart failure. And there's some people, including myself, that believe that it is an additional cardioprotective medication in um, in dogs that are preclinical before they develop congestive heart failure. ACE inhibitors are considered a standard component of management of dogs with congestive heart failure. Okay, so now we're talking about a stage C dog. So when you talk about diuretic therapy or ACE inhibitors, those are drugs that are utilized specifically in dogs that have developed stage C disease. Spironolactone at low doses, subdiuretic doses, may have additional cardioprotective therapy. So you'll see those used in stage B2 dogs, and especially what some people refer to as late stage B2 dogs. Other vasodilators that are used, most likely, if you're going to use an additional vasodilator, it's going to be amlodipine. And amlodipine is used obviously to manage systemic hypertension, but most dogs with valvular heart disease, even dogs that have developed heart failure, do not have systemic hypertension. Amlodipine is used for additional offloading of the ventricle. And that would probably be into the category of stage D. So if you don't want to manage those dogs, you say, hey, I feel pretty comfortable with standard triple or quadruple therapy, which I'll outline in just a second, then you're probably not going to use a whole lot of amlodipine. Digitalis glycosides are not used very frequently at all in dogs with valvular heart disease. In dogs with valvular heart disease, the only times digitalis would probably be utilized would be in a dog with atrial fibrillation that is challenging to manage. Again, probably a stage D dog. So if you don't like digitalis, other than it's pretty flowers, don't worry about utilizing it. And then very importantly, and this is a huge change in veterinary cardiology over the last 15 years, maybe 20, is Pimo. You know it by its trade name as Vetmedin. In other countries, it's seen in combination products. And in the United States, it's not available in any other form other than a single product. It's not available as a combination product. The standard is the chewable, comes in 1.25, 2.5, 5, and 10 milligram chewable tablets, ideally given on an empty stomach. There is a liquid version that was recently approved by the FDA in the United States for some of the smaller dogs that pose a challenge for management. Pimo is a calcium sensitizer. That's really how that's how its positive inotropic effects are manifest. But it's also a phosphodiesterase 3 inhibitor. As you recall, that is a peripheral vasodilator. So it gets back to one of the major aspects of managing dogs with valvular heart disease, which is to keep their vascular tone normal, but also allow them to appropriately vasodilate. The more they can vasodilate without leading to hypotension, the less mitral regurgitation they're going to have. So when you think about mitral regurgitation, the two major determinants of how much volume goes backwards is the size of the regurgitant orifice, which you can't change unless you do some mechanical intervention, okay? Or the relative resistance to forward flow versus reverse flow. And so anything that I can do to open up the peripheral vasculature, or things that I can do through supplementation to optimize the body's ability to vasodilate, the lower the volumetric regurgitation is going to be. And what we know now from the EPIC trial, and I mentioned that before, and it's really the genesis of the classification scheme, what we recognize is that not only will dogs live longer once they go into heart failure if they're receiving Pimo, but in that critical stage of B2 valve disease, we know that we can stave off the ultimate onset of congestive heart failure by an average of about 18 months by the addition of Pimo. So one of the reasons that it's so important to identify these dogs in that transition from B1 to B2 is that's when we can make the biggest impact on longevity and symptom-free interval, which is what we want to do. Okay, so what have we talked about? We've talked about valvular heart disease, the most important adult onset disease in dogs. We've talked about the diagnostics that we utilize to characterize the disease and then ultimately classify the disease. We've discussed the characteristics of the classification scheme, and we'll review them briefly right at the end here. Okay? And then what I'd like to do is say, how can we utilize what we now know about therapy, diuretics, ACE inhibitors, pimobendan, vasodilators, supplements, with the classification scheme? And can we put together a classification scheme that drives intervention, drives therapeutic decisions for these dogs? And I think we can. Remember, stage A, what are we looking at? Well, there's really no indication that we have to do anything in those dogs. We need to monitor them. We know they're predisposed to development of heart disease, so we should be able to communicate to the client, carefully monitor those dogs when we get the opportunity during wellness evaluations. But there's really no indication to do anything for those dogs, at least specifically. Now let's change that. And now we've moved from a dog that is predisposed to disease to a dog that is manifesting disease. So B1 dogs, asymptomatic, minimal cardiac remodeling. There is no indication for cardioactive therapy, but there is logic behind starting cardiosupportive therapy. So cardiosupportive supplementation. So make sure that that patient has every nutritional aspect, every nutritional make sure that that patient has all the substrates necessary for optimal cardiac and vascular function. B2 dogs. B2 dogs, there is ample evidence that those dogs should be started on pimobendan. Those dogs should probably also receive cardiosupportive supplementation to once again make sure that they have all the substrates necessary for optimal cardiac and vascular performance. Whether or not those dogs might benefit from an ACE inhibitor or spironolactone in addition to pimobendan is still under investigation. Once a dog develops congestive heart failure, the consensus study tells us what we should do. Those dogs should be receiving a loop diuretic, typically in the form of furosemide. They should be receiving an ACE inhibitor if there's not a contraindication to it. They should be receiving pimobendan, which hopefully they got started on if they got diagnosed appropriately. In the B2 stage, spironolactone, again, another diuretic, works at a different place in the kidney, is also potassium sparing. And those dogs should continue with their cardiosupportive supplementation. In stage D, and many of you will not want to manage these dogs, but those dogs are typically on multiple diuretics. They may or may not be on an ACE inhibitor, assuming that they're tolerating them. They are probably on pimobendan 3 times a day. They're receiving spironolactone. If they have refractory atrial fibrillation, they may be receiving digoxin or other antiarrhythmics like diltiazem or sotalol. And they still should be getting cardiac supportive supplementation. Remember that as these dogs develop reduced forward cardiac output and especially congestive signs, most specifically if they involve right-sided failure, then absorption of nutrients and absorption of drugs and supplements are reduced. So once again, making certain that these patients have the substrate for optimal cardiac and vascular function is essential. So in summary, when we think about the medications that most of you are probably going to use in the progression of dogs with heart disease, and specifically valvular heart disease, what are the ones that we'll utilize? let's get back to the classification scheme. Stage A, we're not going to give them anything, right? They're normal patients. They're just predisposed. They're normal patients. We're going to follow them closely. We're going to specifically monitor their cardiovascular system each time we get an opportunity to evaluate them. Once they develop B1 disease, then the only thing we're probably going to think about is cardiosupportive supplementation, right? Try and make sure that they have the substrates necessary to optimize their cardiac and vascular function. Once they develop progressive cardiac remodeling, the evidence tells us that we should start them on pimobendan. Very compelling evidence, in fact. Whether or not as they progress with cardiac enlargement, do we add perhaps spironolactone or an ACE inhibitor to their therapy? That's somewhat questionable. But all along the way, their cardiac supplementation, supportive supplementation should be continued. And then once they develop congestive heart failure, that's when potent diuretics are required. So hopefully you've taken away several things from this presentation, including a better understanding of what valvular heart disease entails and how it manifests itself clinically. The classification scheme and how the diagnostic tests we routinely employ help us fit these patients into specific stages or categories of their valvular disease. And then based on that, the knowledge you have associated with the classification scheme, now you can talk to your clients accurately about what is going to happen to my patient. What should I be doing at each one of these stages? What should I look for that might tell me that my dog is transitioning from a stage B2 to C to D? And hopefully you have a better appreciation of the role that cardiosupportive supplementation plays in optimal management of these patients. If you're interested in getting a sample of the cardiac chews, please reach out to Dr. Fossum specifically, and we'll leave a link where you can reach out to receive a free sample. So thanks for your attention. Hopefully you found this useful, and I look forward to interacting sometime in the future again. Thank you so much.